I have just inserted the appliance and am inserting articulating paper to adjust the bite. You will notice that he identifies the right side of the appliance as being too high several times. I then lower the right side. It must be balanced. The appliance must be balanced so he hits both sides when he occludes simultaneously in time and with pressure. One side cannot be higher than the other. He identifies the right side as being too high 2 or 3 times. You will notice that once the appliance has been balanced perfectly, his symptoms immediately cease. Okay, the appliance has just been delivered now, and it's been sitting in the patient's mouth for approximately 5 minutes. And you can see how his activities have more or less decreased greatly. And as he wears this, they will decrease and stay decreased for longer and longer intervals. There might be a few instances where they break through to the surface, but those instances will be fewer and fewer. In the 5 minutes time that the patient has been sitting here, he and I have had a heart-to-heart talk about wearing this full time. And he must wear it constantly when he eats, kisses all the pretty girls in high school, talks and gives reports in class, etc. He has to function with it 24/7, or else it won't do him any good, and he will only be a partially treated Tourette's patient. And that's not good enough for me or for him. You have anything you want to say to the audience? Like you're on TV?
I'm going to take better care of it, and I'm going to wear it all the time, starting now.
Okay, good.
And I just do want to say, I really do feel different right now, and it really does make a big difference.
This is Jesse as he returns 6 weeks later, and what we've done is convert his intraoral orthotic from a pivot appliance to a repositioning appliance, where we have lowered the height of his appliance and indexed it so he is now biting with his mandible in a forward position here. This further decompresses the tissues of his temporomandibular joint. Okay, pan him. You can see him here. Look in the camera here, and say something to the viewing audience here. How you've been doing in the last 6 weeks? You've been in a school play.
I've been in a school play and a band concert.
Okay, don't look at me. Look at that.
Oh, sorry.
Okay.
And I've actually gotten to the point where it's working so well, I kind of forget it's in my mouth, and it's just there. It's already it's part of a normal day routine with it now. And a lot of my tics, I've noticed, have kind of drifted away to the point where they mostly never come up. I haven't gotten mad at all since I've gotten this piece in, to the point where I've yelled at someone. I haven't yelled at anybody in a long time now. I haven't been emotionally overbearing at all in any state, and I have a clear mind every time I have it in, that I can think about my work and get it done, and my grade's been going up. So
I'd like to introduce you to Jesse's father here, who has accompanied him, and to say a few words. Come on in here.
Yeah, Jesse's teachers have reported back to us that his tics are significantly less during class time. His focus is better, and we've definitely felt around the house that Jesse's ticking less and that he's more peaceful. There's some kind of emotional connection here too, where just not ticking so much has helped him to relax in a lot of areas. But he was yelling certain words 2 to 3 times a minute, and now we can go an hour and not hear it at all.